Howdy, I'm Dr. Leslie Easterwood, and I'm an equine veterinarian, and I'm going to show you what happens when we do a farm call. So this is what I do most of my day. I'll have some in-house appointments, but I'll also have some farm call appointments. So here's a look at what happens on one of those. Well, as you can see, I've got a truck that is specially designed to hold all the things that I might possibly need on a farm call. And inside these boxes, they're all designed a little bit differently, but I can have anything that I need in here, from medications to bandage material to equipment that I might need. Most ambulatory vehicles will have an ultrasound machine and an x-ray machine, so we can do most of the things that we could do in a hospital situation out in the field. So we have a horse that we're going to look at today, and so I've gathered up a few things that we might need for that, and we'll sneak inside and take a look at him. Alrighty, well, come on in. This is our vet area, and as you can see, we've got a set of stocks that we've got him in. Some places have that available to us and some don't. So sometimes we actually have to change up how we do things and where we do things. But this is a really nice barn that has all of this set up for us. So we'll stop and we'll take a look at his eye. Okay, big man. How are you today? So he came in out of the field last night and he has a little abrasion on his eyelid right here. And so we're going to take a look at that. He's got an old scar on his eye that he's had for a while, so we're not too worried about that. But we are worried about this abrasion that he has up here on the top of his eye. And then he's also due for his Coggins test. And any of you who are doing the veterinary science program know that a Coggins test is for a disease called equine infectious anemia, or EIA. And he's due for that. And so we'll pull a blood sample on him for that today. Okay? So we're going to take a look. He's got an old injury to his eye. Some of you who are pretty astute may have noticed that he's got a white spot on his eye, and that's old. But what we're looking at here today is this new abrasion that he's got up here. Okay? So what we'll do first is we'll listen to his heart, and we'll take his temperature, and then we'll start looking at that eye. Any of you that have worked for equine veterinarians know that your day is never the same. Okay, Bubba. Alrighty. Okay, well, his heart rate is normal, his temp is normal, his lungs sounded good, and he had good gastrointestinal sounds on that exam. So we'll transition into looking at this eye. And you see there's an abrasion that has happened. And we want it, but he's holding his eye open nice and good. He's got a little bit of tearing here. But when we look into his eye, he's got a little bit of cloudiness, and that's from that old scar. And then he's got this abrasion above his eye that actually could have been a split in the skin, but it really looks like just an abrasion. So a soft tissue abrasion. He'll probably do okay with that. What we worry about, though, in this area is whether he has broken this zygomatic arch over the top of his eye. So any of you that have been through the anatomy lessons yet know that this bony arch above the eye is the zygomatic arch. And so that's a problem for us when they hit their head like that, because their eye stands out to the side so far, and he certainly could have. He's not sore to it at all, and it doesn't feel like there's any give to it. So it feels like that's okay, and that this is probably going to be a soft tissue injury that he'll get by with okay. But we'll go ahead and pull some blood on him for his Coggins test. And then we'll stop and we'll talk through the owners and talk to them about what we'll do next and what we recommend, because it looks like he'll probably be okay with this abrasion. Okay, little man. So we have a vacutainer. They use these in people as well. We sneak in here. We just get that into the vein, and we're going to pull a little blood sample from him. Good job, big man. There you go. Good job. Okay, well that's a tiny peek into what I do for a living and what it's like being an equine veterinarian. There's so many parts to the day that I could spend all day here with you talking about all the things that we do, but that's a little small part of it.